Hi, and welcome to Conversations with B'nai B'rith International. I'm CEO Dan Mariaschin. Thanks for tuning in today. If you enjoy this series, make sure you subscribe to the B'nai B'rith YouTube channel and like us on Facebook to watch our latest interviews. And of course, visit our website, b'naibrith.org, to learn more about our humanitarian and advocacy efforts across the globe. B'nai B'rith protects seniors and serves as a respected voice on a range of issues affecting older adults, including housing, aging in place, Social Security, and Medicare. When our Center for Senior Services staff heads to Capitol Hill to advocate on these and other issues, we frequently partner with an organization with many aligning priorities, the American Association of Service Coordinators, also known by its acronym AASC. AASC is a professional membership association and a national resource for service-enriched housing professionals who will continue to be vital to the fabric of our society as America ages. AASC's nearly 4,000 members assist elderly and disabled residents and families living in affordable housing communities to identify, locate, and acquire the services and supports necessary to become and remain self-sufficient. Established in 1999, it provides education, advocacy, best practices, leadership, and networking opportunities for its members. The B'nai B'rith Center for Senior Services has a long relationship with AASC. CSS staff and AASC have been partners in our congressional advocacy efforts regarding our affordable housing program, and staff from both organizations have presented at each other's respective conferences. In addition, B'nai B'rith advocated on Capitol Hill to have service coordinators included as part of the crucial Section 202 federal housing program. In my conversation, I'll be speaking with Michelle Missler, LSW, President and CEO of AASC. She'll be highlighting the critical role service coordinators play in senior housing, aging in place, our advocacy relationships, and our shared policy goals, and more. Michelle Missler joined AASC in 2020 as Vice President with 16 years of experience in affordable senior housing, service coordination, and program development, and became the President and CEO in January 2021. She has a long career working with older adults, including as Director of the Service Coordinator Program for the National Church Residences, the nation's largest nonprofit provider of senior housing in the United States. B'nai B'rith is the largest national Jewish sponsor of non-sectarian, federally subsidized housing for older adults in the United States, with 38 buildings in 28 communities, providing affordable housing for more than 5,000 people. Working in partnership with the Department of Housing and Urban Development, B'nai B'rith makes rental apartments available for senior citizens with limited incomes. We pride ourselves on our unparalleled expertise and leadership in protecting seniors, advocating on aging issues, and supporting our senior housing service coordinators, which we'll be speaking about today. Michelle, welcome. We're delighted to have you with us.
Thank you so much for having me, Dan. I'm really excited for this conversation today.
Well, thank you for being here. First, can you talk a little about your organization, the American Association of Service Coordinators? Give us an overview of AASC's mission beyond what we've talked about in the introduction, its membership, and the organization's role in the senior affordable housing sector.
Yeah, absolutely. So as you stated in your overview, the American Association of Service Coordinators started in 1999. Our founder and CEO at the time, Janice Monks, really saw an opportunity for an organization to come into the affordable housing space that would be focused on the service coordinator profession. At that time, service coordinators were starting to be funded more and more by HUD, but there was a lack of standards of practice. And so that was the main focus of the service of ASC at that time, to ensure that there was a standards of practice, that there was continued public policy and advocacy for the profession. And that continues to be our mission today. How do we ensure that the 4,000 service coordinators that are our members across the nation not only have that connection, that network, but they also have the public policy arm that's advocating for things that they need to do their jobs better, to advance the program, but then offer the education, the professional development opportunities to ensure that there's a standard of practice with the profession and continue that profession as we can.
Well, many families in the country, of course, have family members that are in these facilities. But if for those who are not necessarily connected to that directly through family, if you could give our audience a sense of what service coordinators do to assist older adults to age in place and how they actually help families and individuals from a socioeconomic perspective.
Yeah, absolutely. I can speak from this firsthand and as my role now. I started my career back in 2003 as a service coordinator. So I have very intimate knowledge of what the role of a service coordinator is and what the purpose of them is in the properties. So service coordinators are really there as a teammate to the property manager, to the maintenance folks in an affordable housing property. Their role is really to assess the residents, build those relationships with residents in affordable housing, and then make appropriate connections as they see and identify needs for those residents. They're also a linchpin for those family members, as you said. They're there as a resource for the family members to ensure that they're communicating what are the needs of the residents if the family's not nearby or they need assistance in navigating any of the social systems within our communities or federal governments. And service coordinators are experts in that. They're experts in understanding what are the benefits that residents in affordable housing are capable of achieving and getting. And they become those experts, but they really become experts in relationships. And we saw that especially over the course of the pandemic, and making sure that those residents who were so isolated had the ability to connect with someone who understood and can help navigate any of the recommendations that were coming from local community, public health, or the federal governments. And so the relationship piece, I think, is always the most important. But then there's that connection to resources to help them age in place is also very important.
Well, I would think you need to really be a special kind of person to be in this field. You have to have a lot of patience. You have to have a lot of understanding. You have to be able to encourage, and the list goes on and on. How do you recruit for this particular field to get that kind of person?
Yeah, interestingly, when it comes to the HUD guidelines about what background a service coordinator should have, luckily there's not a lot of prescriptive, information about that. And I think that really helps the position to be successful, because it's not a position that is easily obtained with a degree. I think it comes from the heart and it's mission centric. And oftentimes the service coordinators that we find, they've already potentially had a career and this is a retirement job, or they just enjoy working with others. They enjoy that relationship building. They enjoy solving problems. And so I think really it's about who has the patience and the understanding and the respect and can provide the dignity to those residents living in affordable housing, who can operate as a teammate on a very small team, right? A lot of times it's the property manager and maintenance person, and that's it for the team, who's self-driven. It takes a lot of, autonomous work to be a service coordinator. They're often alone in their profession in the buildings, but really it's about the caring heart. It's about how do I build and develop relationships while also, considering the ethics and the boundaries that are necessary to be successful, and then deliver the services to help, the mission, which is aging in place, keeping these individuals housed.
Well, you're only the second president and CEO of AASC since its founding more than 22 years ago by Jan Monks. Since Jan started AASC, service coordination has changed from referrals to more of a case management role. Between your time at AASC and your previous experience overseeing the service coordinator program at National Church Residences, can you share how service coordination has changed over the years?
Absolutely. I love that question. So, originally in the profession, I think it was really more reactive of a profession. So someone would come to you and they would present a need, and the service coordinator would then get involved and help address that need. Over the years, the model has really shifted to be more proactive. They call it the enhanced service coordinator model at times, where a service coordinator is really getting to know every resident in the building that's willing to, interact and work with that service coordinator. They're doing more full assessments. They're trying to understand the entire picture of the residents and then get ahead of any needs prior to them becoming, a quote unquote crisis. And so I think really the biggest shift in my opinion, in my experience, has been that, rather than sitting back and waiting for a resident to bring you an issue to deal with, it's really about getting out in the community, getting to know your residents, and identifying things before they become a crisis. I think that's the most important change, and it really engages our service coordinators and allows residents to age in place longer.
Well, we can't have this conversation without talking about COVID-19. You took the helm of AASC during a difficult part of the COVID-19 pandemic. Talk, if you will, about how the pandemic has shown a spotlight on how important service coordination in affordable senior housing is to the well-being of residents and even management staff. We had several conversations like this with my B'nai B'rith colleagues and others during the period of COVID in terms of how we were coping at that time in our various buildings and properties. So tell us, if you can, how the pandemic affected all the work that you and your colleagues do.
Yeah. Well, the pandemic affected all of us, right? Respectfully so. But, I remember sitting in the office and hearing the news of the pandemic and hearing the response of CMS, for the nursing home population, and thinking to myself, what's the response for our affordable housing residents, right? They're a very similar population. We knew that the pandemic was really affecting older adults who lived in congregate housing of any sort. And our service coordinators were on the front line. I often said during that time that service coordinators were built for this. They were trained for this. Their whole role is to connect to resources to keep people safe and healthy and housed. And, in the times of the pandemic, they went into supersonic mode. They really spent their time working from those relationships that they had with the residents, ensuring that residents understood what the public health priorities or public health guidance was and how to navigate that. But the biggest thing that they did is they helped combat the social isolation. So we all knew that social isolation was going to be a huge challenge. I mean, I felt socially isolated, right? We all did. And the residents in affordable housing were no different. If anything, they were probably more isolated because they were at a bigger threat of the pandemic as those years went on. So what we did to try and support our members and their support to the residents was provide as much education as we could, the information that we were getting, encouraging them to reach out with any challenges or questions, but then really from a public policy standpoint, really advocating on the imperativeness of support for the service coordinators, making sure that they had the support that they needed to continue to work on site in the property. So is that PPE, or was that, additional funds, additional money to help support their efforts? But that advocacy continues. So, for us, we were able to participate in two pretty large research projects during that time, one through Johns Hopkins and one through Joint Center of Harvard Center for Housing. And both of them were studying the impact of COVID-19 on both service coordinators and residents in affordable housing. What we learned through those research studies, and that was, largely done with our service coordinators, was that the lack of internet connection, the lack of digital, understanding was really something that created more social isolation challenges. And so a big part of what our public policy priorities are now is really about that digital inclusion and digital advocacy to ensure that folks have access, but not only access, but understanding of how to utilize that access. I think that was one of the biggest learnings that we uncovered during that time.
Well, as I touched on in my introduction, our Center for Senior Services staff has partnered with AASC on our advocacy efforts in Congress for over many years. Mm-hmm. How did the partnership come about, and why does it remain so important to the residents of affordable senior housing, having that intervention, if you will, with Congress, with Capitol Hill?
Yeah, I think it's imperative. I think it's imperative for all of us to come together to tell our collective story. And so that's how I see our relationship between B'nai B'rith and AASC. But any organization that's serving residents in affordable housing, I think we have an absolute calling to make sure that we are sharing the voices of those living in affordable housing, but the folks that are doing that work. And I think collectively our voice only gets stronger. And so we see it as a real opportunity to stand in front of Congress or to share information to HUD. That's really a large part of what we do, making sure that they understand exactly what the experience is in HUD affordable housing, how we continue to make it better for not only the residents, but those serving the residents in affordable housing. And I think that a collective voice is always the most impactful. And, we're aligned in all of our public policy priorities. We see this profession very much the same. We see the importance of a mission of service coordination. And I think for our two organizations, it just makes sense for us to, join our voices together and really become even stronger. I know one of the biggest things that our organization loves to do is that when we are in Washington, D.C., is to utilize your properties to be able to take, representatives out and see how that works, because it's really important for folks, especially who are making laws and political decisions, to see exactly what it is that they are making those decisions on behalf of. And so I know that that's been a huge part of our partnership, is us to be able to utilize your properties, your residents, your service coordinators to share that story directly.
Are you finding more receptivity to issues affecting seniors? In this particular case, we're talking affordable housing, but generally speaking, on the Hill, not only members of Congress, but perhaps equally important, their staff members. Are people listening to the issues that you're presenting? Because that's extremely important in terms of moving ahead for broader budgets, for more activity that can advance the interests of seniors.
Yeah, I think that there's always the champions that we have, right? And I think that there are definitely folks who see and value this profession. I think the bigger challenge I believe we have is really gaining the understanding of how people are choosing to age. And so there's been a societal shift in how we desire to age. And a lot of folks desire to age in place, right? They desire to age in community. And therefore, our funding programs, such as Medicare, even Medicaid, those programs need to shift as much as what, other programs have in the past. But from a support at the congressional level, this past year was very exciting for us. We were able to introduce a bill for the service coordinator profession to try and increase funding for that. And that was the first time that AASC has ever been able to do that. And we got support. And while it didn't go in front of, a vote or anything like that, it was absolutely a monumental moment for there to be a service coordinator bill. And what our plan is for this year is to reintroduce that, try to get bipartisan support, and really to try to get it in front of more folks. And if nothing else, that really helps us put a limelight on the service coordinator profession and start conversations that we haven't had before with some individuals.
Well, you've really opened the door for my next question. In fact, answered part of it. What are AASC's policy goals and priorities for 2023? You've talked about the issue of the recognition of the field and its practitioners. Has the pandemic, going back to that for a second, has it affected those priorities at all for this year?
Definitely. So one of the things that we recognized quickly in the pandemic was, it's what we've always known, but I think the pandemic gives us a stronger footing for this, is that there's not enough service coordinators. So there are quite a few buildings that could have a service coordinator, but either the funding's not there, but there is a massive need for us to have service coordinators in every affordable housing building. What we recognize and what we already knew prior to the pandemic, but the pandemic highlighted for us, is that service coordinators are imperative for the residents in affordable housing. And so that's a big part of what we're asking, is that every affordable housing property would have access to a service coordinator and funding for a service coordinator. And that is, that's always been an ask, but I think the pandemic has helped us to be able to highlight that in a different way, in addition to the research that we've been able to do. The other big thing that I think the pandemic helps inform as far as our public policies is that digital inclusion. making sure that the residents in affordable housing have access to internet, have the ability to pay for internet, but then also have the technical assistance to be able to navigate, the internet connection. So that's another big priority. We really want to see every affordable housing complex be able to have internet access or affordable internet. It's a big, lofty goal, but you've got to start somewhere, right? And so introducing those thoughts is really important. And then, new this year for us is really a focus on rural housing. It's very hard to say. So, recognizing that there is a lot of service coordinators and there's a lot of rural housing through the USDA program that is unsupported as it relates to how do we connect individuals residing in those types of properties to services. It's a very different job when we think of a rural housing model versus an urban housing model. The connection to transportation, the connection to resources is much more difficult and oftentimes lacks a service coordinator. So those residents are really isolated in a different way. And so we want to encourage USDA to increase funding or at least introduce the program of service coordination and create opportunities for those properties to have funding for a service coordinator.
So folks who live there, it's kind of loneliness plus. It's not only living in a facility where you're there together with other folks, but you may not see your family. But when you're removed by hundreds of miles from urban centers, I suppose it even adds to it. It's an interesting void that you're seeking to fill. So that also plays into my final question, which is, what do you see for the future of service coordination? I mean, you've just talked, for example, you've talked about internet access, and that means that the service coordinators also, I suppose, have to be up to date and tech savvy in order to make that work. So what do you see down the road in terms of the future?
Yeah, it's a great question. I think, down the road for all of us, I think we get more connected digitally, and we have to understand how to navigate those things. But I think more and more, down the road, one of our other public policy priorities is the increase in affordable housing. I think having more affordable housing, having more opportunities for folks to age in place in this kind of a capacity, but also increasing the service coordinators in those properties. I think additionally, it's the connection to efforts that healthcare is doing. How do we connect the dots between social determinants of health and what service coordinators are doing and what the efforts are around managed care and other healthcare entities? I think there's a real opportunity for all of us to work in collaboration in some sort of way. And it's something I'm constantly advocating for. What that looks like, I don't know for sure, but I know that a service coordinator is a linchpin as it relates to reducing healthcare costs and ensuring that evictions are prevented. The model in general is extremely powerful. And it has a tried and true history. We have the data to tell the story of service coordination and the impact. And I think that it's just a matter of continuing to spread that message to the right audiences and continuing to diversify the funding, relying less heavily on just HUD, but increasing the ability to expand the program even beyond what we are today.
Well, I think of the biblical injunction, the fifth commandment, I think it is, of honor thy father and thy mother. And really, Michelle, you and your colleagues in your field do so much to bring that respect and that dignity, that recognition to our older citizens. And we deeply appreciate the work that you do. You can learn more about AASC's vital work as a professional membership association, national resource for service-enriched housing, and key advocate for service coordinators by visiting servicecoordinator.org. Michelle, thank you for delving into AASC's advocacy work, support for its members and older adults, your leadership, and of course, the invaluable partnership between our two organizations. It's been a pleasure.
Thank you.
Thank you again to Michelle Missler and to you for watching this conversation with B'nai B'rith. If you enjoyed the interview, subscribe to the B'nai B'rith YouTube channel and like us on Facebook for all of our latest content. And be sure to visit our website, bnaibrith.org, to learn more about our important work. For my guest, Michelle Missler, I'm Dan Mariaschin. Join us again soon.